Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, today I want to present a topic to discuss about. But before it, allow me to introduce myself first. Hi, my name is Fitri Adzan Ramadhani. I'm a college student majoring in the Department of Biology at State University of Jakarta, and I'm here want to discuss about coronavirus. We all have been affected by the current COVID-19 pandemic. However, the impact of the pandemic and its consequences are felt differently depending on our status as individuals and as members of society. People try to adapt to working online and learning online. Much of daily life has been colored by the coronavirus. Virtual learning is the norm at many colleges and high schools. Many extracurriculars have vanished and social life have stalled for students complying with a measure to stop the spread of the COVID-19. What is coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with a protein spike. This gives it the appearance of crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronavirus that cause illness in animals and in humans. In humans, coronavirus can cause respiratory infection. Transmission of COVID-19 occurs via droplets transmission, contact transmission, and aerosol transmission. Droplet transmission occurs when the respiratory droplets produced when an infected person coughs or sneezes are inhaled by a person nearby. Contact transmission occurs when a person touches a contaminated surface and there touch their mouth, nose, or eyes. Aerosol transmission occurs when respiratory droplets containing the virus mix into the air and then inhaled by people. COVID-19 is stable for up to 24 hours on cardboard, 2 or 3 days on plastic and stainless steel, and up to 3 hours in aerosol, which include fog mist, dust, air pollution, and smoke. Therefore, it is possible to get infected by touching contaminated objects or through the air. COVID-19 symptoms. If you are not feeling well, you should immediately consult a medical practitioner to have an accurate diagnosis and proper treatment of COVID-19. Call your doctor or local health department if you think you have been exposed and have symptoms like fever of 100 Fahrenheit or higher, cough, trouble breathing. Swab test. Swab test is the most common method. Swab tests look for signs of the virus in your upper respiratory tract. The person giving the test puts a swab up your nose to get a sample from the back of your nose and throat. That sample usually goes to a lab that looks for virus material, but some areas may have rapid tests that give results in as little as 15 minutes. If there are signs of the virus, the test is positive. A negative test could mean there is no virus or there wasn't enough to measure. That can happen early in an infection. It usually takes 24 hours to get results, but the test must be collected, stored, shipped to a lab, and processed. Swab tests can only tell whether you have the virus in your body at the moment, but you may also consider taking an antibody test which can show whether you have ever been exposed to the virus, even if you didn't have the symptoms. This is important in officials' effort to learn how widespread COVID-19 is. In time, it might also help them figure out who's immune to the virus. Coronavirus prevention. Getting vaccinated against COVID-19 is a key part of prevention, but you should also take these steps. The first step is cover your nose and mouth in public. If you have COVID-19, you can spread it even if you don't feel sick. Wear a cloth vest covering to protect others. This is not a replacement for social distancing. you still need to keep a 6-foot distance between yourself and those people around you. Don't use a face mask meant for the healthcare workers. The next step is wash your hand. Wash your hand with soap and water or clean them with an alcohol-based sanitizer. This kills viruses on your hands. The next is don't touch your face. Coronaviruses can live on surface you touch for several hours. If they get on your hands and you touch your eyes, nose, mouth, they can get into your body. Practice social distancing. Because you can have spread the virus without knowing it. You should stay at home as much as possible. If you do have to go out, stay at least 6 feet away from others. The last step is clean and disinfect. You can clean first with soap and water, but disinfect surface you touch often, like tables, doorknobs, light switches, and toilets. Wear gloves when you clean and throw them away when you are done. So, thank you for attention. I hope you find this information is really informative for you. Thank you. I hope you have a good day. See you. Wassalamualaikum warahmatullahi wabarakatuh.